My name is Neil Morte, and I've served as an online adjunct faculty member at SNHU for community and public health courses since March 2022, around there. And my current role in the field is I serve as a contract employee through a strategic HR and consulting firm that serves different industries and entities. It's called Wired People Inc. And my title is Antibiotic Resistance Coordinator for the Florida Department of Health, and it is within their healthcare associated infections team that serves our 67 counties and 7 regions across the state. Yeah, there's definitely a lot of variation in that. Typical day definitely varies day to day, week to week. So the main objective in my role alongside an antibiotic stewardship lead is to assist, support, and educate acute care hospitals and long-term care facilities, like I said, across the state of Florida on how to improve antibiotic prescribing to best treat bacterial infections, combat antibiotic resistance, and improve patient and resident safety and outcomes. So each week there definitely a lot of learning opportunities. We do a lot of webinars, we do a lot of meetings, collaboratives that we do with the University of Florida, whether that be at the county, regional, state, or national levels. We get updates from our epidemiologists, our infection preventionists, and our Project First Line educators weekly on investigations, anything that they see interesting, educations that they do with different facilities. So whether it be about preventative measures, so about hand hygiene, wound care, injection safety, disinfection, or in my area, antibiotic stewardship and resistance. So, one day of the week, I may be meeting with a hospital's infectious disease pharmacist or an infection preventionist and discussing their practices and how to improve upon them, any way that we can support. And then another day, I may be analyzing or exporting data from different sources. So we can gauge, how facilities are doing when it comes to antibiotic prescribing and the effectiveness of a particular antibiotic against a specific bacteria. So, as a whole, as our team, we have a lot of goals to achieve based on our grants, and we make sure that we stay on track with those. So our team is basically one big resource, that healthcare facilities can reach out to, and we can support and, answer any questions, and they can implement the best practices to prevent the spread of, healthcare associated infections. So that's kind of what the day-to-day looks like, and, it definitely varies, but each week is definitely just more about learning opportunities and how we can best support our healthcare facilities and partners. Yeah, I really love the question and sharing with, students and how to foster that growth. And so, my advice to, SNHU learners looking to get into the field or continue within it is to, connect with, different practitioners and, connect with students, connect with, professors and, faculty members, and asking different questions and having those conversations about different roles in the field, and to just be a sponge, with community and public health being interdisciplinary, multidisciplinary. There are so many, great aspects about the field where collaborations can take place. And I think that's what really got me into it, is just the collaboration aspect and how, we can all just work together and pick each other's brains, and, how we can improve, our, health in our communities. Sometimes you'll learn about an area in the field in a place that you don't expect. I learned that I wanted to be in the public health field through a history class, actually. It was a history of disease course during my undergrad, and that's where I learned about epidemiology and, different health events that really impacted us. So that really got me into, this passion and working in just more of a community feel. So I feel like the more information that you can gather, the closer you will be to what you're passionate about, and you can serve as a pillar in the communities that you want to assist, and then you can apply and share that knowledge and expertise. So, really just having those conversations, asking questions, and seeing what's out there, and just having that kind of exploration aspect of it. I mean, I feel like public health is about just exploration as well, and just figuring things out. So I feel like it kind of goes, hand in hand with, students learning and getting into the field. So.